Hello, my name is Leslie Cantona, and I'm here to propose my capital investment plan. The purpose of this capital investment funding is to expand services and increase patient volume by providing accurate diagnostic images in cardiac angiograms, perfusion, and pediatric imaging to accommodate our physicians and patients. Achieving positive results is a key strategic goal that I would like to present. I believe that maximizing the wealth of our shareholders by acquiring assets and yielding profits will give us the results we are looking for. The expansion of services that we will offer will increase productivity, allowing us to provide better quality care for our patients. In order to build volume, we will be required to market our new scanner and services to all providing physicians within the area. According to Michael Vanier, a professor of radiology and medicine at the University of Chicago Medical Center, and I quote, "The reality of having patients with low heart rates who can hold their breath long enough and don't have any diseases is quite impossible to obtain with the 16-slice computer tomography scanner." End quote. However, patients who have arrhythmias, fast heart rates, obese, and squirming pediatric patients will receive better diagnostic images with a 64-slice CT scanner. While costs may seem high, we will be able to provide better patient care through the more accurate diagnosis. The main idea of obtaining a cardiac timing angiogram image is to be able to image the heart all at once, and in order to do that, the timing is everything. The scanner needs to be faster in order for the patient to provide a long breath hold and also to accommodate the heart rate at the same time. The higher slice systems will show that CT can perform with any perfusion applications for both liver and brains as well. Nuclear medicine has been the standard care for perfusion imaging. However, the low resolution does not provide a clear image of the anatomy, which can miss small perfusion defects. The higher slice CT systems eliminate artifacts that are shown on the 16-slice scanner and also have the capabilities to freeze images to reduce motion, especially on pediatric imaging. Not only does it eliminate and freezes motion, it reduces radiation to the patient. Another plus with the 64 CT scanner is that it has a treatment option for patients with atrial fibrillation, which is known as catheter ablation, and this exam allows technology the ability to reconstruct images that are needed every 10% of the cardiac cycle with 1 millimeter slice thickness. I have taken the liberty to establish a team that will include myself, the lead radiologist, both lead CT technologists, along with a cardiologist, neurologist, and an orthopedic. The radiologist is a medical doctor that specializes in diagnosing and treating diseases. In order for him to make an accurate diagnosis on an exam, he will require special cuts and reconstructions. The radiologist is also the person in charge of creating protocols in which the CT technologist will have a guideline as to what is required for per exam. The cardiologist is the heart specialist who sends their patients to our facility. He is a physician that orders the test in regards to what he is trying to diagnose in order to treat his patients. The neurosurgeon is the physician who specializes in the brain. Many patients have head injury, and a neurosurgeon has specific orders in which he is trying to rule out. The orthopedic is the physician who specializes in bone. He requires certain images as well in order to operate on his patients accurately. We've included the cardiologist, neurosurgeon, and the orthopedic because we wanted to accommodate their needs in order to provide patients the best quality care. Based on our revenue sources, 38.7% is paid by Medicare, 14.3% is paid by Medicaid, 4.3% is by workers' comp claims, 39.3% from private insurances, and 3.4% are patients out of pocket. So based on our monthly revenue, we've averaged about 20 outpatients a day, 10 being with contrast and 10 being without. with an average of 7,200 patients monthly. A CT exam with contrast, the average cost is around 3,500 using a 16-slice CT scanner. And the average charge for a CT exam with contrast is around 5,200 using a 64-slice CT scanner. A CT exam without contrast has an average cost of around $1,500 using a 16-slice CT scanner, and with a 64-slice CT scanner, we're looking at an average charge of about 2,550. Because the 64 slice is more advanced and enhances patient safety by significantly reducing exposure to radiation, while still providing high quality CT images, doctors are able to diagnose everything from cysts and tumors to blood diseases, blood clots, hemorrhages, and infection. This CT technology can also perform screenings for early detection of lung cancer and virtual colonoscopies for the non-invasive detection of precancerous polyps and colon cancer. With such incredible speed and coverage, these scans allow us to diagnose at earlier stages and without invasive or surgical procedures, as previously required to make the diagnosis. And that means earlier treatment for potential better outcomes and providing high quality patient care. So looking over the whole investment proposal, the cost of the equipment is around $250,000 and with the cost of $100,000 for labor. So in order to increase profitability, we will need to market our new expanded services to our networking physicians and community for the amount of $25,000. The cost to train our CT techs is around $10,000. The expected useful life of years for the CT scanner is roughly around 30 years. However, if we maintain a monthly preventative maintenance service for $22,600 a year, we are able to last longer than 30 years. In all, the revenue outlasts the startup cost or capital. With the right roadmap, structure, and design training, we can increase productivity, patient care, and volume. With the endorsements of our shareholders and partnering physicians, we will be able to make a world-class care facility that will help our patients in the long term, as well as being advanced technologies into businesses to continue to build a strong foundation and future for our company. So that concludes my capital investment proposal. I have listed some of the references I used during my presentation, and I hope you will consider my proposal. And thank you for listening. Have a good day.